Okay, so now we are going to look at some of the nucleus of hypothalamus. So I have arranged all of these nodes, all of these points for hypothalamus nucleus. So hypothalamus is a part of the brain that is located. It has different nucleus like anterior nucleus, posterior nucleus, and supraventricular, paraventricular nucleus, and mammillary bodies, lateral nucleus as well, and medial nucleus. So these nucleus has different role and different functions of the bodies. Like let's suppose this is car. In car there is anterior part is for radiator and it controls cooling system. So anterior hypothalamus is for cooling system. This car is posterior system. Posterior system is for carbonator which loses heat is for heat loss, temperature control system, hypothalamus, posterior nucleus. And laterally there is a door, a person goes outward and hungry to go outward. So hunger nucleus is located in the lateral, and that is known as the satiety center. And medial nucleus is for eating. So medial nucleus is for eating. And there is also a top, that is supraventricular nucleus. Supraventricular nucleus is for ADH and oxytocin. ADH and oxytocin mechanism release, which goes downward into the posterior pituitary gland. And then there are also paraventricular nucleus. Paraventricular nucleus is for ADH, oxytocin, and supraventricular nucleus is for melatonin and sleep cycle regulation. So these are some nucleus of hypothalamus which are very important to memorize. So let's suppose the anterior and posterior temperature and cold maintenance nucleus. So what happens when heat generating mechanism is activated? Different mechanisms comes out. Thyroid hormone increase metabolic rate and production of heat is done with the help of ATP. In cold temperature there is activation of sympathetic nervous system, and they activate beta receptors on brown fat, and metabolic rate and heat production is done. And in coldness their shivering is increased and heat production is increased. Cold temperature activates shivering, and shivering is for posterior nucleus. As I already mentioned that a car has posterior side for uh, uh, heat generation, heat gaining mechanism posteriorly. Anterior for heat loss mechanism, cold generation. So what happens for in cold temperature, posterior hypothalamus is activated, and alpha motor neuron and gamma motor neuron is activated, causes contractility of skeletal muscle and heat production happens. Then comes heat loss mechanism occurs via anterior hypothalamus and decrease sympathetic nervous system. Cutaneous blood vessel results into vasodilation, results into heat loss. And heat loss is also by evaporation is done, which activated by sweat gland under sympathetic muscarinic control. Vasodilation also results into loss of heat. Okay, so hypothalamus set point for body temperature is hypothalamus sensors on skin, and hypothalamus read core body temperature and then relay station to the anterior hypothalamus. Anterior hypothalamus causes uh, cold temperature maintenance. Anterior hypothalamus loses heat, and anterior hypothalamus compared to detect core temperature is set point. Core temperature is below set point, heat generation is activated. If core temperature is above set point, heat loss is vasodilation is activated. So pyrogens increase set point temperature that results into fever, and fever is mediated by pyrogens, aspirin, steroids. So pyrogens increase production of interleukin 1 in phagocytic cells. Interleukin 1 acts on anterior hypothalamus and increase prostaglandin results into increased set point temperature, and heat generation mechanism is increased and fever is produced. Aspirin reduces fever by inhibiting cyclooxygenase pathway and decrease set point of body temperature results in heat loss, vasodilation and sweating is activated. Steroids reduce fever by blocking arachidonic acid pathway and prevention of the production of the heat. So in this way, uh, Malignant hyperthermia is also a concept. Is characterized by susceptible individual having enzyme deficiency of inhalational anesthetics or suxamethonium, and a massive increase in oxygen consumption, heat production because of skeletal muscle results into rise of the body temperature. So this is very important concept you have to keep it.